All right, so we are going to go over preparing a rubber dam system for our patient or for our mouth. We're going to do this in two parts, one for the setup and identification of our instruments and such. The second part will be going and actually applying it in a couple different ways. So you should have a sheet that is accompanied with you. It could be either as a digital file, or I might be giving it to you hands-on. It just gives you the same type of tray that we have here, just labeled out and positioned in a certain way. So I'm moving out to the side. One thing that we're going to do is notify a couple things. We have many different types of clamps here. So the clamps that we are going to be using that I like and enjoy, it depends on your doctor that you're going to use, is these winged clamps, especially for the posterior. They have wings off on the side where it extends out past this little area, and those wings are on both sides of this clamp, versus over here where this one does not have those wings that extend past the jaws like that. So let's speak a little bit about these clamps. We have three different types here. There are plenty different types, sizes, and configurations. Like I mentioned before, I enjoy the winged side. It's a little bit more helpful when we're applying a rubber dam, but your doctor may have a different one. We have one here that almost looks like a butterfly, kind of like its head and the wings that stick out like this. So we have certain ones like these that go for our anterior teeth that we will use it for. Some doctors may also have a preference on which type that they'll use also, but this is typically used for anterior teeth when we are working on them. When we do identify any parts of these clamps, we have, like I mentioned, the wings that stick out. We have the jaws area that clamps onto or holds onto the tooth, and then on the back side we have the bow. And it's very specific on where the jaws go and where the bow is directed towards, or where it points towards, which is usually towards the distal or the posterior of the mouth. Other things that we have alongside here is our hole punch. We have different styles, but this is a specific hole punch for what we have here. In those, we have the punching, the little plunger, and we have this little rotating stylus here. You can hear it clicking, and if you're to look into that little stylus a little bit into the holes, you can see that there are large holes and small holes. Depending on what tooth you're going to be punching for, you're going to need to set this up for the correct tooth. Usually for this larger hole that we have here, this is for our anchor tooth, or the tooth that is going to have a clamp on it. That can be whichever tooth that we're using. Going down to the fourth size, that is going to be for specifically molar teeth. Going down to size 3, that is going to be for cuspids, so that means premolar teeth or canines. Those are going to be for those those types of teeth. The size 2 is going to be for maxillary anterior teeth, so excluding the canine, this would be for centrals and laterals, so 7, 8, 9, 10, 23 to 26. And size 1, the smallest hole, is going to be for lower mandibular teeth, the laterals and centrals, so that's 23 to 26 when we do that. So first start off, I'm going to set it up as number 5 punch hole, so I can punch for my clamp tooth first. We have our rubber dam material. One side is going to have more of a glossiness to it, while the other side is going to have a dull sheen to it. You want to have the glossy side or the reflective side towards the patient's skin. You're going to want to have the dull side facing outwards or away from the mouth or away from your patient. Just like our bibs, where the shiny side is down towards the patient, the dull paper side that absorbs is going to be facing upwards away from the patient. So we're going to have it as such. Have 2 pieces of floss, one to be able to hold on to the clamp, another one to go and floss our rubber dam into place. So we'll go into that here in a bit. We have our rubber dam clamp forceps that's going to allow us to take our little prongs that are at the end, fit it into our rubber dam clamps holes that are there, and then when we put force on the clamp, on the forceps, it's going to open up the jaws to allow us to put it onto the tooth. You have this little sliding lock right here, so if you go and expand your jaws really wide and you go and lock that in, it will hold it open, ready so that we can pass it off to our doctor or the assistant that's going to be placing our rubber dam on. So it's at the ready. In the moment, because I don't want to put too much stress on the clamp and I want to keep it nice and firm or tight when it locks onto the tooth, I'm going to let it rest and not expand it at the moment. Always have your basic setup. At least for this instrument or this setup, we're going to be using a mouth mirror, and we're going to use a plastic to be able to apply to the tooth. Extra supplemental things that you could have maybe at your office, if they do have one, is stencils. So pretty much a guide on how to mark up your rubber dam material. This one is a stamp version, so you have where it says maxillary, mandibular, and it has a guide to where all the hole punches you're going to punch at. Usually with that, you're going to need some ink, and you're going to need to set it up. So I'm going to get this nice and started. You're going to have your material. Make sure that you stamp the dull side, so always verify where you're going to go. This is a 6x6 rubber dam piece, so this is pretty much a normal square, and I'm going to make sure I stamp right in the middle and really put pressure on it so that every little place marks up. When you pull it off, you'll get a good representation of where the holes should be, or where you're going to be punching for them. I have the maxillary up here, mandibular on the bottom, and I should have 32 holes that I can potentially punch, and this is going to be our useful guide. At this moment, we are going to be applying our rubber dam to the patient's lower left, and I'm going to be using tooth number 18 as an anchor tooth, and I'm going to be isolating the whole lower left side. We're isolating so that we can either work on on one of the teeth as a root canal, or we're isolating the whole quadrant for a full quadrant set of restoration, such as 4 or more fillings or whatever the doctor might have planned. Because I'm going to be working on my lower left side, I'm going to locate my lower left. So here's my lower mandible, here's my patient's left side, and I'm going to punch for those different holes. As I mentioned before, I'm going to start on tooth number 18. That is the second dot from the last over here. I'm going to take my hole punch, set to my anchor tooth, because 18 is going to be my anchor tooth, and I'm going to go right over to where that hole is, or where that marking is, and I'm going to punch through, hold it, flip your material over, and you're going to want to pull the rubber dam material through that hole so it's completely cut through. It's really important to make sure that you cut it all the way through so you don't have any loose hanging pieces. As an example, I'm going to do this off over here on the corner. If I was to just go and do a quick little cut and I don't pull it through, you can see that there's a small little tag that could potentially stick off. And that tag, usually what people will do is when they see that, they'll go and pull it off. And just like the cuticles on our nails, when you have that little piece of skin that hangs off on the side, and you go and pull that, it pulls more, rips off more than you probably anticipated. So make sure that you go and completely cut through it, not pull it off and potentially rip your rubber dam prematurely. Now that I got my anchor tooth punched, I'm going to go switch over to size 4, because right in front of that anchor tooth is going to be a molar, which is my tooth number 19. I'm going to punch for that, pull it all the way through, line up for my third hole punch on my stylus. I'm going to go and set up for tooth number 20, pull it all the way through. Tooth number 21 is the same hole punch, because it is a premolar. Going to make sure I go and pull that all the way through. Go to my canine, same punch, so say it's a size 3. I'm going to go and get myself navigated over to my third hole punch spot. Got that through. Switch over, because I'm on my lower mandibulars, I'm going to switch over to my size 1 between my canine, between my lateral and my central for 23 and 24. And I'm going to go and punch both of those spots. Pull through. And pull through. Awesome. At which point I have this all set up for my patient's lower left quadrant isolation, so that I can do whatever I need to. As you get better, you get a little bit more comfortable with kind of eyeballing your shot here. You'll be able to kind of just mark a certain spot with a little bit of saliva when you test it out in the patient's mouth, and just go and pop a couple holes for it as you need it to be. So we're going to take this and we're going to start going over to our next little part, which is going to be placing it onto the tooth in certain types of ways. So I'm going to pause real quick. All right, the next part that we're going to go to is placing our rubber dam onto our teeth. We have a couple different ways about doing this. You can either go and take your rubber dam material and stretch it over the tooth to be able to apply it to every single tooth and then clamp it on afterwards. That is an option that some prefer, where they'll have to go in there, or where they'll have to go into their patient's mouth, find every single hole that goes for every single tooth. So I'm going to start with my largest hole, my anchor tooth, my tooth number 18, and you can go and start slowly fitting it over that patient's tooth and go along that line, knocking out every single one. That's an option number one. After which you go and lock that all up. You're going to go and make sure that you put it on the frame correctly, and you go and put it on the clamp on. But we're going to go and do a different one, a little bit more easier to be able to do it sometimes. One option that you can use is going and putting the clamp on first. When you go and put the clamp on, remember, like I said before, our bow faces the distal of the tooth, or towards the posterior. If you set this up where you have your forceps in the clamp just like this, where it's almost like a hill, a depression, and then another hill, you will always set this up like this. You will never be wrong when you go place it in the mouth. So I'm going to set it up just as so. I'm going to go and place it on here, tooth number 18. Go in the patient's mouth. Sometimes you have a tongue there, so you'll need to take your mouth mirror, reflect the tongue, or reflect the tooth, or reflect the cheek. Go and get it and have it on the neck of the tooth. Now, you want it to sit on the neck of the tooth. You don't want it to sit on the gums. If it's on the gums, it's going to create a lot of discomfort later, because right now they may be numb, but later on they might have those pressure little marks from the rubber dam and a little bit of bruising right there. So make sure it's at the neck of the tooth, not on the gingiva. Once you get it on there, release your grip on your forceps. Make sure you're not locked in anymore, and slowly wiggle yourself out. Now that we have our clamp on the tooth, we are going to take the same way as we mentioned before. We are going to take our rubber dam, take our holes, and you're going to slip it over the clamp and then the tooth subsequently. Now, when you go and slip it over the clamp, it may be a little bit difficult. You may want to take it in one step at a time. So taking the largest bit, we're going to take it and slip it right over the bow of the clamp. Once you get it over the bow, you want to take it one step at a time. Start with the outside, or the buccal portion. You can go and pull it over the clamp's wings and jaws. Once you get it over on one side, start working on the other side. So now I can start pulling this over the clamp on the lingual side, getting it in position. And once I get it into place, we can start lacing up all these other teeth with their specific holes. So I go over here to tooth number 19, I go over here to tooth number 20, and I keep on going until I get them all into place. Once I get all of them through and punch through, I'm going to take my rubber dam frame, and the way that you do this is you'll take one corner at a time. Go one corner, hold it, and kind of get it snagged by that little spike that's sitting off to the side. Keep holding it in that direction, and once you have it there, you're going to go onto the opposite corner, opposite side, and you're going to snag that on that little spike. And as you get one corner and then the other, you can start lacing up all the rest of them. Now, right now, it's not going to look too hot. Well, that's because we still need to make a couple of adjustments. For one, your rubber dam should not be laying flat on the inside of the mouth. Remember, patients have cheeks, so that's going to be really difficult to do in real life. The rubber dam frame and the rubber dam and everything is going to be covering all the teeth and such, just like so. Now, we're not done here, because we still need to pop in all the other teeth through the rubber dam holes that we have placed. But one key thing to look at that I have going on right here is that when I have this in here, you can see as an example on the wing on this side, is that this wing is exposed. The rubber dam material is underneath that wing. That's how it should be. But over here on the lingual, I don't have that wing exposed. We need to expose that wing and get it nice and push through. So with that, you can use a little bit of finger pressure, and try to negotiate your rubber dam material underneath that wing so you can get good isolation. Right now the tongue's in the way, and doing this without two hands is going to be a little difficult. So let me get him situated using our mouth mirror. I'm going to go and pull this tongue away from the area so that I can actually go and push that through. Once I got that, I can snug this underneath that wing and get what I need going. Now at that point, I got that wing exposed on the lingual side. So now I can start moving forward with the next little parts here. One thing that's important to do is, because I'm just using this tooth number 18 as my anchor tooth, you can see that tooth number 17 back here is exposed. It does not need to be exposed. Take your plastic instrument and kind of pick it over. Don't try to slice it or pop your rubber down, but you're going to want to gently negotiate it over that tooth so it's hiding it. You want it hiding it, and then eventually you're going to want to floss that right in between those two teeth so it's nice and covered up on all areas of this tooth. So I'm going to go ahead and pop all the rest of these teeth through. Make sure that I got good ligation, everything's nice and tight. I'm going to go and move on to tooth number 20, 21, 22, 23, and 24. Now as you get more forward, you'll notice that the teeth are not going all the way through. You're going to need to floss them through. So that's where we have our extra pieces of floss. It's good to have two of them, but get your floss. It's nice to have a double, to overlay your floss so you have a thicker floss to run through. Once you get that in, you're going to go and floss these teeth, the rubber dam material, in between these teeth so that it gets pushed in between and it hugs around the tooth. Really good. Got that. Go every single tooth. A little bit of the tough one to do is when you go to the last one. Like I mentioned, you have to go behind the bow, negotiate it to this place that you need it to be, which is between the teeth. A lot of times when I get to this point and I hit a snag, I like using my plastic to lift it up and get it over to the place where I need it to be. Take this. Once I got that in place and where I can floss it through, I'll go and really get that through, and I'll pull it off to the side at that point. Right now I have all the teeth on my lower left quadrant that I'm going to be working on ligated, or I have them all isolated. Make sure that you get every single piece through. Do another run through with your floss. Everything's looking nice and ready here. Another thing we're going to do is we're going to what's called invert our rubber dam. So what I'm going to do essentially, because right now it has a little turtleneck collar that's going on, I'm going to take my plastic instrument and I'm going to flip inside out the rubber dam pieces, and I'm going to do it on the buccal, and I'm going to be doing it here on the lingual surface, just like so. I'm just pushing it in, inverting it so it creates a nice seal on the buccal surface like I'm doing here. You're not trying to push into the sulcus of the tooth, but right now you're just trying to invert and flip those inwards. I'm going to do it on the lingual surface here. Same thing, it's great to have a plastic instrument to do this with. It's nice rounded, it's not sharp or anything. It makes it really simple to be able to do that. Cool. Nice thing to do to make sure that you have everything all secured is to make sure that you ligate your teeth. Now, some people will have fancy ways of being able to tie teeth down, but what you can do essentially is just take your little double floss. You can go and floss it in between the last tooth opposite to the anchor tooth, and you can just have it tied like so. where it's going to be holding it down, and just make a little knot if you need to. There'll be tons of different ways to be able to get this really fancy and going, but for the most part, as long as it's tied down, you should be able to do fine. Just like so. Some people like snipping it, some people like leaving it so that they can have control over it. But essentially right here is what we have if we're going to isolate for a quadrant. The next one that we're going to go into is isolating a single tooth, and that was going to be when we're doing it for like a root canal or such. The last thing that we're going to do, we go through a tooth. You're going to show me it. Make sure it's nice and centered. Everything looks pretty. Everything's standing up straight. It's not kinked to the side. You can do a lot of nice adjustments to make it straight after you get it all isolated and linked through the holes and such. It just depends on how your doctor wants to see it and how you go right there. Essentially, that would be my quadrant style. The way to remove it, you're going to go and make sure you get your ligation off. You're going to go and take your clamp off, usually to start, and you're going to start popping all the pieces of these holes out. Now, there's a couple ways to be able to do this. For one, go ahead and get your forceps, get yourself onto the holes and such, and get the clamp off, and you're partially there. Put that off to the side. The quick way to be able to to take this off, but it destroys the rubber dam from being used again, is to take a pair of scissors, a little iris scissors or suture scissors, and you're going to cut between the septums. If you pull off to the side, and you can see these septums in between all of these holes that are there. If you go in from that point, just make gentle cuts and make sure you don't cut into the patient's tissue or anything. It makes it a little bit easier to go and remove this from the patient's mouth. Go there, pull it all the way through. Make sure that when you pull it out, that you get every little piece out. So that means sometimes there are souvenirs left behind. Get that piece of floss that you've been holding on to, go in between all these teeth, floss out any green little bits that are left behind, or what we call our souvenirs. Make sure there's nothing left over between those contacts. And you can send your patient on the way. The next part that we have here would be a little bit more easier version, just to do it on the same tooth, tooth number 18 or tooth number 19, and we're going to essentially set it up for like a root canal, where we're just going to be looking at either one tooth, maybe two potentially, through our rubber dam. Grab your frame, grab your rubber sheet. This is a 6x6, shiny side down, dull side up. You'll put it on your frame to start, just to kind of make it easy. Like I mentioned before, start at one corner, get it hooked. Start at the opposite end quarter, get it hooked. Makes it a lot easier to be able to situate this as you start going. We are going to go and place it on the tooth to find out where we're going to punch our hole. Now you can just eyeball it and say, oh, but lower left corner, you're going to be somewhere in this direction, and that's completely fine. If you want to be a little bit more on the spot, you can go and put it and set up right in front of that patient's mouth, have them open, and go and touch that tooth to where the rubber dam is going to go and hold on to it. So if I'm touching over here on tooth number 19, I know right about in this spot, and usually it's marked with saliva, will be where I go and punch it. So I'm going to go punch for that little spot here. I'm going to go and release it a little bit so it's not strained. I'm going to take my size 5 punch, because I'm punching for the clamp tooth, and I'm going to go and put it right down where that used to be. Now, some doctors will want the hole a little bit larger. Some of them will just want singles. So right here, this is a single punch in that area without the guide. Some of them will want almost like a figure 8, one punch right next to the other. So it's a little bit larger, able to hold the rubber dam. Some of them want like Mickey Mouse style head to it. But essentially, once you get that punch in, make sure that you have your rubber dam frame in place. Some doctors may want the frame on the outside. Some may want the frame on the inside of our rubber dam. So it's just kind of how you go from there. Get your winged clamp, and you're going to insert the wings of the clamp through the holes. Just the wings. So when you look at it, when I placed it, I just have the wings inserted, not the whole jaws, not the bow or anything. So we're pretty much just part way in. I'm going to show that once more. Grab the wing, go and insert it into the hole, take the other side, insert the wing just like that. At that point, I'm essentially just about ready to put it on the tooth. Grab your forceps, make sure that you're putting the bow towards the center or towards the distal of the mouth. Have it ready. You can go and directly put it on the tooth. Important thing though, because right now my teeth are color coded, in your patient's mouth it's not going to be color coded. So you must take extra, double, triple care to make sure that you're on the correct tooth. Doctor's putting a lot of trust in you to be able to apply this rubber dam. So if you're going in there and you have to count it, that's a canine, that's number 22. Here's number 21, here's 20, here's 19, that's my root canal tooth. Then make sure you double, triple, extra count. Get it around the tooth, get it around the neck of the tooth, the cervical area, take it out. Next part is going to be a little bit easier. Usually doing a root canal rubber dam is a lot easier. You're already framed up in this method. All you have to do is you need to pull the rubber dam off of the wings. Easy way to do that is you can either do it by finger pressure and pull it, such as this one where I'm going to go and pull it underneath the wing. Make sure that it gets around the tooth and it's nice and isolated. Or you can use your plastic and you want to gently lift up that material. Whatever you need to do to be able to get it to work. Some people have better luck. Some people pop this when they use an instrument. Once you get those areas underneath the wings, you want to make sure that no extra teeth are visible. So right now I'm seeing a little bit of tooth number 20 in this one, but I'm not seeing number 17 like we did before, so that's awesome. I need to get this material over that so it's not, so that we have a good seal around tooth number 19. So at that point, it's good to have that little, it's good to have this instrument, go and pick that up and move it over the tooth so we don't have any issues. Sometimes if you don't have enough material or it feels like it's not going, relieve yourself right here so that nothing's being pulled extra, so you can give that tooth room to be hidden underneath the rubber dam. Same thing as you're going to do before is you're going to take your floss, make sure you double it over, make it thick, and you're going to floss it through on the buccal and on the lingual side. Floss it through, pull out the side, floss it through, pull out the side. Same thing on the distal area. Get it over there. Get your floss negotiated. There we go. And get that floss in the distal. Pull it out to the side. A lot of times some floss strands will be left over. And set it up so it looks nice and pretty for your doc. That's a quick way of doing it. That's a great way for doing it for root canal. You will be doing it both ways. When I have you set up in the rooms, you're going to be going and putting it on either for quadrant dentistry or for root canal. So this depends on what room and what situation or scenario that you get. Same way that you go about when you pull it out. Sometimes it's a little bit easier because it's a single tooth. You can usually just go, grab onto the clamp, open it up, and usually when I open it up, I like pulling the rubber dam out with it if you have the opportunity, so it just comes all out as one. That makes it a little bit easier because I can still relatively use this rubber dam if doctor for some reason says, hey, we need to go right back in there for some reason, something on the x-ray wasn't correct or something. We can at least either flip this around or rotate it so that we can use this rubber dam and not have to grab a whole new one if we need to. Make sure, once again, no little green souvenirs in between this guy's teeth. Bam, 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 bam. Send them on their way, take the x-ray, do what you need to do, schedule them. But that's essentially what our rubber dam techniques are, either quadrant or it's going to be single tooth. Same things apply for the anteriors, just requires a different clamp. Apart from that, I think that should be it. Sometimes in your offices when you go and, sometimes in your offices, the doctor might want to have the clamp ligated, or they might want to have it tied down to the frame. In that case, if you're going to have a clamp tied down to the frame, have a piece of floss that you can use that with. And with that piece of floss, what you're going to do is you're going to go and tie a knot in it. So you can go and take it in a loop, kind of fold it over itself, pass it underneath the bow of your clamp. Once you pass it underneath the bow, grab outside or grab through the through that loop with your 2 fingers, and go and grab the tails of the floss. And once you have that, let's see, oops. So to be able to tie a knot, go ahead and kind of fold over the floss just as so. Take that loop that you created and pass it underneath the bow. Once you have it underneath the bow, you can go and grab it, put your fingers through the bow, and grab the tails of the floss that you had a moment ago. And when you go and pull it all the way through, you got a nice link to it. At which point you can go and do whatever step order that you want to. Maybe you go and put it onto the tooth, so if it flies off, you can at least keep control of it. You might have it, while it's on, tied to the rubber dam frame, where you have it loose. You have it tied down so that if it goes flying off, it doesn't go across the room, that it just stays or hides right next to the patient. So those are different options that you can have too.